has a seizure disorder. Sarah doesn't talk, she doesn't walk. She depends on somebody for everything that she needs. Sarah's mother, when Sarah was born, they diagnosed her with breast cancer. So she died when Sarah was 2 years old. So I'm actually, Sarah looks at me and I'm Mama, because I think she remembers her mom, but you know, I'm Mama right now.
When we visited Sarah at Harris Hillman School, she had just returned from therapy in a prone stander, a device that allows her to experience activities in an upright position. Sarah is clearly exhausted from the effort. Sarah's next activity is in an area called the Snoezelen Room. This program, which originated in the Netherlands, is not likely to be found in a regular school setting. Snoezelen is used with children with severe disabilities to enhance sensory capabilities through a combination of visual, auditory, aromatic, and tactile activities. Sarah's experiences at Harris Hillman are clearly different from those she would have in a regular classroom. Kathy Perroni admits that the struggle to determine what is best for Sarah, given her level of developmental disability, is one in which there are often more questions than answers.
What if Sarah had been included in a regular classroom from the time she was 5, when she was supposed to start school, until now? Would I see a child that could communicate better in some way? Would I see a child that was a lot farther along than what Sarah is? So sometimes you kind of like, you sit and you wonder, well, should I have done this or shouldn't I have done this? And I don't know the answer to that. I know that in our personal lives, there's my husband and myself, and I have a teenage daughter that's getting ready to go to college, and I have Sarah. And in a routine day, it is just impossible that I would be able to do all the therapies, all the things that you love to do, the music therapy, teaching Sarah sign language. There's just not enough hours in the day. And it's like, we tried different approaches with Sarah, and she does some things, her teachers will do it, and then we'll follow up at home to see if she'll keep up. But for instance, she might be doing really well at drinking out of a cup or somebody feeding her with a spoon, and wham, she gets ill and she has to go into the hospital. We regress and we go all the way back to where we'd started from, and we have to come back. Sarah's very special to me. I love her very much, and I said she has meant so much in my life, and all the struggles, all the time she's been sick, the time she's been well. I've lived over here at Harris Hillman. I was PTA president for 4 years. I've volunteered to do everything and all this kind of stuff. But I mean, she's my child just like my oldest daughter is. I love her, and I wouldn't trade all these years with her for anything.